This is Stuart Berwick, and I'm from Dallas, Texas. I am a patient. I was diagnosed 16 years ago today. Prior to it, I had been on holiday in Europe and found great difficulty climbing the Duomo in the Vatican. So when we got back to the States, I immediately started to look into why I was having so much trouble breathing and having no stamina, while I was just a few months earlier just fine. As I was walking up that Duomo and had these little old ladies passing me by, I thought it was more than just asthma or things like that, because I wasn't sneezing. I didn't have anything that had felt like what I would have equated with an asthma attack. I really felt like I needed to look into it. And I am also a cancer survivor. So I think that's maybe why I push harder for a diagnosis. I started seeing an internal medicine doctor as soon as I got back. And at first, we were led down the path of whether it was asthma or something like it. And so I tried various asthma medications and nothing seemed to help. Then I went to a hematologist, and we found that my blood had way too many red blood cells in it. And I was diagnosed as having something called polycythemia vera, which is a disorder from the bone marrow where you produce red blood cells in abundance. And we learned later on, of course, this was because of the pulmonary hypertension. My oxygen levels being down, I started mass producing the red blood cells. For 18 months, I would go into their offices and get a liter taken out per week to try and stay ahead of how thick and heavy my blood was with red blood cells. Finally, after a year and a half of that, I had a bone marrow biopsy, which indicated that there was no problem in the bone marrow and there was no cancer. So there must be something else that's doing this. I was referred to a pulmonologist, and when I saw him, he said, "I think I know what it is, but I hope it's not what I think it is. And I need you to go to see a cardiologist." And 16 years ago today, I saw that cardiologist, and he came in, and I passed out after about 40 seconds of doing the stress test. And he said, "Oh, you need a double lung and heart transplant." I went, "What?" He said, "Yep, you need a double lung and heart transplant. You have what looks to be pulmonary hypertension." So in shock, I went out into the lobby and told my wife and mother that that was the diagnosis I had just received, and went back to the pulmonologist, and he immediately referred me down to Baylor in downtown Dallas for their transplant program and for the PH program too. At 16 years ago, there was one therapy and an IV therapy, and I'm still on it today, 16 years later. So I've made a lot of IVs in the last 16 years. At the beginning, I was put on a transplant list. At that time, the transplant list was a time-based system. And with only one therapy being available, they wanted me to have a backup plan in place just in case that the IV therapy didn't work. So I went through all of the tests and inoculations, etc., to qualify for a double lung and heart transplant, and waited for my 3.5 years. And then when I got to the 3.5 years was December of 2004. And on January 1st of 2005, it went to a score-based system, and I was no longer eligible. In December, my name had been called twice for some organs, but the doctors had turned them down, knowing that the score-based system was about to take place and that I was way too healthy at that point to be considered for a transplant. First, I took it pretty hard in that I had had that date as like a goal for myself to reach with my daily mixing of the IVs and going through all that trouble and seeing the doctors and missing work. But there was always that goal of getting to that 3.5 years so I could get transplanted. So when I was told that I wasn't going to get it and that what I should consider now is to look out to 5 years of survival. And when we got there, it was, well, now we look to 10 years. And so, yeah, we moved the target. And I'm actually on the inactive list, but still, if my score goes up, I will get right back into the transplant list. So that's a comfort. I think for me, at first, it was very hard to accept that I had to move it out to the 5 years. I wanted to get it over with. But, a month after being told, I think I came to that realization that, yeah, it's much better that I not be transplanted at this time. And if I get to 5 years, the doctors have just learned that much more about transplant, and they're 2 years more experienced. And each time I pushed it out, I thought about the experience that the doctors were gaining in that time that I was inactive. And I still look at it that way today. Back in 2001, the HIPAA rules didn't exist, and Baylor encouraged us to come ahead of our appointments for our quarterly meetings with the PH team. And in those meetings, we may meet other PH patients. We also met other recipients have already gotten transplanted. And we met people with other diseases that were related. And so it was really good for us, at that time, my wife and I, to be able to meet these people and know that they are doing pretty good or not. Face-to-face really helped. It helped clarify things for me. It helped identify that people could indeed survive on IV therapies. And it also seemed to me that the people that did the most were the ones that succeeded the most. And so I was happy to be working at that time and trying to live a fairly normal life. It couldn't always be normal, but I would try as much as possible for it. And having a chance to talk with the other patients and finding out what was successful for them in their lives and what they couldn't do anymore or what they could helped me come together with the disease and realize it wasn't the end of the world and that there's a future. I just have to figure out how to make that future. I've been on several research trials, some through Vanderbilt and Cleveland Clinic and others, but they're mainly large group trials of just blood samples and things like that. I think that any patient should be involved in a clinical trial because when you look around and see the other patients that are fighting this disease, you can see that they got there and they're on their therapies because somebody else took that step to go on to a clinical trial. And not all of the trials and research is where you are going to take a pill or a placebo. A lot of what is learned from either blood samples or DNA or other ways of doing research. It's not all specific to one pill or one type of therapy or another. It can be a deeper research into whether a certain gene is showing up as being a problem gene for PH patients. I know for myself that I feel I need to be available to the PH community and get involved in every trial that I can. And not all the trials are going to be on the latest med from whatever company or whatever kind of method of taking that med. So if we can just give some of our time and maybe some of our blood, or if you get the chance to where you do get to do a real clinical trial of a stage 3 or stage 2 drug, then I think that we should feel a certain obligation to our fellow patients. Well, I grew up in a family where volunteerism was just part of our family life. Whether, now my concentration on volunteering has either been through my church or with pulmonary hypertension awareness or helping other patients with pulmonary hypertension. But when I was a kid, I was always volunteering, even in my early teens. I was a volunteer fireman, and after I got the cancer and luckily came through it, I went back to the hospital and became an EMT to volunteer again with my local fire department. And when I moved to Texas, I volunteered with the sports car club because I used to race cars. And so it has always been part of my DNA to volunteer, and my mom and brother and sister are the same way, and my mother at 86 is still volunteering. I just feel like everybody has that in them to volunteer, to help another patient, to help with their support group or help with pH aware or whoever. You need to give of yourself to get back, is the way I look at it. I'm Stuart Berwick, and I'm aware that I'm rare.